Hello, Namaskaram
Ladies and
Vivekji.
gentlemen, this is a very special program which we are bringing you today. And Dr. Priya V. Balakrishnan ji, she is joining us from United States. If you all recall, she had come on this platform with us earlier to serve the humanity. And today we have got a very special address from her side. We requested her, and she is joining us today. And ladies and gentlemen, we all know that at present the world is passing through very difficult times, and there's almost an emergency which we have to take into considerations. And whatsoever measures can be taken by all of us, we should try and save every soul, every human being on this planet. We got to be more empathetic. We got to be more concerned, and we have to come out whatever we can do for the humanity. Today on 26th of April, Monday, 9:30 p.m., in the special program, we extend a very warm welcome to Dr. Priya Balakrishnan ji.
Thank you for having me,
She,
sir. Thank you.
Madam
God
is
bless.
from the Immortal Institute at Houston, USA. And this program is being brought to you with the special efforts of our session chair, Dr. Vivek Shankar Natarajanji, who is a professor of marketing at the Lamar University, and he's also advisor to our chamber. Ladies and gentlemen, the cases are rising. Medical facilities, whatever are available, in spite of making optimum use of those, I think what is needed at this point of time is people got to be calm, careful, taking all necessary precautions which have to be taken during any emergency, and particularly in the medical emergency, because this particular program, the corona, it doesn't know who you are, your caste, creed, color, place, society, civilization, religion, nothing. The moment you just overlook, things go out of your hands. I think in this difficult moment, we all have to rise above the occasion, and we have to think what best can be done. Our chamber, International Chamber for Service Industry, is more humble today because Madam had been very kind to join us and to share her vision. And we extend a very warm welcome to Dr. Priya V. Bala Krishnanji from United States.
Thank you,
And
sir.
I would request Dr. Vivek Shankar Natarajan to take the discussion, deliberation, vision, everything ahead. And we will have this program only for 20 minutes. Please go
Thank you.
ahead.
Um, Gulshanji, namaste. This is supposed to be one of
Namaste,
the
Gulshan.
challenging, namaste Priyaji,
Namaste, Vivekji.
challenging
Namaskar.
time for anybody who has any connection with India with terms of news. But again, I don't know how, our concern is about we need to save lives. We need to make sure the pandemic doesn't get out of control. And right now there is no reason to do blame gaming, which is kind of what I see in some of the traditional media. But as scientists, our game is to see how can we prevent the erosion of the infrastructure and make sure can come back. Because at least for a year India was doing, I guess, had a decent report card, but there are variants, there are mutations. So this is like, sometimes it's like a cricket match, one day match, the things change very drastically. So the idea is not to do the blame game, but to see what we need to go forward. Just want to offer a couple of prayers for for making sure
Yes,
people
please. Thank you.
are safe. So one is to the Mrityunjay mantra, the other one is the Dhanvantri mantra. Then I'll have a prayer
And
for,
Lord Ganesha too. Just one Ganesha quick
yes.
prayer and
So
yeah, thank
yeah, I'll do the couple of prayers, and then we have Priyaji. Priyaji is a trained nephrologist, board certified, and who has extensive experience in reversing kidney failure. And she has been spending a lot of her medical research on this topic of what we can do during the pandemic. So I'm going to give the floor to her. So quickly, my prayers, and then our prayer to make sure India comes out strong. As somebody with deep roots in Indian civilization and our traditions, I think we will come out okay, and we will pray and make
Yes,
it
sir.
sure
Thank you.
that there is no more problems. Om Shri Ganeshaya Namaha. Om Shri Mahasaraswati. ओम त्र्यंबकं यजामहे सुगंधिं पुष्टिवर्धनम् उर्वारुकमिव बन्धनान् मृत्योर्मुक्षीमामृतात् ओम नमो भगवते वासुदेवाय धन्वन्तरि अमृतकलशहस्ताय सर्वामयनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे नमः। ओम वागर्ताविव सम्पृक्तौ वागर्तः प्रतिपत्तये जगतः पितरौ वन्दे पार्वती परमेश्वरम्। ओम समस्त सन्मंगलानि भवन्तु। ओम इति स्वस्ति प्रजाभ्यः परिपालयन्तां न्यायेन मार्गेण महिं महिषाः गोब्राह्मणेभ्यः शुभमस्तरित्यं लोकाः समस्ता सुखिनो भवन्तु। Priya ji, we trust science. Our shastras say, trust science, trust the Vaidyas. Yadrishim bhavanam kuryat. Beshaje. Yadrishim bhavanam kuryat siddhir bhavati tadrishim. That means whatever faith you have in the medical system and the doctor, that faith resonates back in terms of fast cure. So let us turn over to science. Let us turn over to our Vaidyas, our doctors. And so Priya ji, please, the floor is yours. We want a message of hope. We want a message of what we can do to improve the things, turn the ship around. Thank you.
Thank you. So thank you so much for the opportunity to do a small part to assist our Mother India, our Bharat Mata. It is very troubling and it deeply concerning, and we've all been near tears watching the images, the heartrending, heartbreaking images from India, and the pleas and cries for help from doctors and medical personnel who are themselves throwing themselves into this fire to fight it. All I want to say is that we are here for you. We are here standing by in every way that we can help you. And that in addition to taking care of the usual precautions that WHO has put out in a very in-depth document, and including Centers for Diseases Control here, but WHO document is just as good. So definitely wear the mask, maintain the social distance, wash the hands, don't touch the face or the eyes, and stay home as much as possible. Try not to have loud conversations in enclosed areas. These are all measures to reduce the risk of transmission. There are many more, and definitely keep people who are vulnerable, sick, elderly, who have chronic medical illnesses like diabetes, like kidney failure, keep them safe and at home, and try not to go out. And for this period of time, we should really respect the vulnerable and the weak more than showing that we can do this, we can do that, we are not sick, we have to take care. Yes, but we can take care even more by becoming that weak person and following those same strict precautions as much as it is possible. Obviously, everybody has to earn a living, but as much as it is possible, please try and work from your home. As much as it is possible, please take care of vulnerable, elderly, sick people. What I would like to share, and with all prayers to God, is that there is a technique that is world over being accepted now, that is reversing and curing this disease all over world. Europe has published, particularly Italy, a lot of data on this. When you all may recall last year in February, March, April, how Italy suffered. And I have sent Gulshan ji the videos of how I do this procedure. I don't know if they can be loaded onto this Zoom call for other people to download if they can. Vivek ji, I would like to send it to you also. I use a mixture of medical gases, medical oxygen, and there's a machine that makes this medical oxygen into medically usable ozone. And this machine that I have is called Herman, and it is from Germany. It is a very expensive machine. It's tens of thousands of dollars, but India makes an equivalent machine that is just as good. It is made in Bengaluru. I think either the manufacturer or the gentleman's name is Anand. I will get some more contact information for you. And so, if we have medical grade oxygen, and this procedure should only be undertaken by a physician, it cannot be done by paramedical ancillary staff because the patient has to be examined before administering this therapy. And it's deceptively easy looking, but people in the wrong patient, if it is administered without care or without listening to their heart, their lungs, or taking a good history, medical history, this could have unforeseen potential problems. And it is very safe. Millions of people have undergone it and have come out successfully out of COVID. And so it is very successful against almost any viral infection. So um, and certainly in COVID. So this is the procedure that I would like to discuss. It is you have also an Ozone Forum of India. They are not recommending my procedure. They're using similar gaseous mixture. They're recommending giving it through the other end of the gastrointestinal tract, which we call rectal administration. And that is a very safe way of doing it. It has variable absorption and it may or may not have as great of an efficacy, but it is very safe. So, and what I'm doing is also very safe, but only a doctor can do what I'm doing. And what Ozone Forum of India is recommending, pretty much anybody can do. So the reason why that only a doctor can do this is because if a person has rheumatic heart disease or they have valvular heart disease or they have glucose 6 phosphate dehydrogenase deficiency or they have a systemic fungal or mold infection, then this procedure can be potentially very toxic to them. And it can precipitate adrenal failure, adrenal crisis, from a very severe, what is called Jarisch Herxheimer reaction. So that is why only a doctor should do this procedure. Otherwise, with doctors doing this procedure, it is almost 100% safe. This gaseous mixture at a very low concentration, like 30 micrograms per milliliter of gaseous mixture, can be very slowly administered using a small 27 gauge scalp vein needle system into the peripheral vein. You can start with 2.5 to 5 ml because most Indian people are small made. We can start at a low dose and give it slowly over 5 minutes or so. And if the patient retain the patient with the first treatment for the first 30 to 45 minutes, ensure that they're breathing okay, no problems. If they have chest tightness, have some oxygen ready to give them. Not everybody has that. And then the next time you give it, which could be the next day, you could go up to 5 ml, and the next day you could go up to 10, and the next day you could go up to 20. Usually, about 3 to 4 treatments is all that is required, and the person can come out of this because their body's immunity will kick in because this is a very potently microbicidal gaseous mixture. It kills virus, it kills almost anything. And for that reason, we must also remember that the gut microbiome will be affected. And additionally, a lot of it also causes a lot of dehydration. So hydration is essential. And hydration, how it is done is we take a liter of purified or filtered water. We can add a few crystals of pink Himalayan salt to it, and we can add a squeeze of lemon. And that is safe to drink as soon as we wake up in the morning. Drink half a liter, and then drink at least 2 liters in a day. With this amount of hydration, when this treatment is given, and can take yogurt or some other probiotic containing, fermented food to in order to replace the bacteria that will be killed off by this procedure in the gut. So this is what I have to offer, and I'm willing to train 2,500, 3,000 doctors in this. There are a lot of potential other things that can come up as we're doing these treatments, and those discussions are better reserved for the doctors that will take the training, because any questions they have, I can share answers with them. And what I want to humbly reassure everybody is that it is very safe and it is very potently effective consistently against this virus. And so, and I also want to share that from my family side, Dr. Viss and the entire family, and Vivekji as well, helping us. We have spoken with the Congress people here who represent India's interests, who are also Indian American. We've asked them to release all these products that the Serum Institute of India needs for manufacturing more vaccine, that their Indian government or Indian newspapers are calling trade embargo. We've asked them to lift that. And last night I read that US has already doing something for this. We had spoken to them 4 5 days ago. Um, it may not be related to our speaking to them, so that's fine. But I think a lot of people like us are speaking to representatives here in the US and putting pressure to help India. We've asked them to release oxygen cylinders because we've read articles in Indian Express and other BBC and other places where they're saying there's enough oxygen. And now Prime Minister, we've read, has asked for either 851 or 651 new oxygen manufacturing facilities to be set up all over the country. We bow to him for taking the correct action. We were asking for oxygen cylinders, embargo, or whatever they're calling it, to be lifted so that these can be shipped to India. Uh, I'm working with my classmates in high school and in medical college. I've taught everybody this procedure. I've told my classmates to pass it on to as many doctors as they know, chiefs of hospitals and things like that. I'm on standby on WhatsApp, ready to help anybody that needs clarification how to do it. Some of the classmates have said that they have oxygen concentrators available in a warehouse in China. And Dr. Viss has said he will look, if they can send us the address of the warehouse, he can look into how to collect it and ship it. Obviously, waiting for a ship there may not be enough time like waiting for a ship. Like some can come by ship and some can come by air. But we are waiting. Dr. Viss is also arranging for cloth masks to be sent, a bulk order to be sent to India. So, God willing, all this will come to pass. And for our side, this is all we know to do. If you need anything, please ask. And we are here to help in every way that we can. And we thank God for blessing and taking care of our brothers and sisters in India and for lifting this plague and this terrible disaster from our mother country. Thank you.
Thank you, Dr. Priyaji. What I
Thank you,
would like
Gulshan ji.
to
Namaskar.
make a request to you, because as it's a medical terminology and medical process and procedure, whatsoever is to be used in this,
Yes,
it
sir.
would be most appropriate because Dr. Vivek Shankar Natarajan, who is the advisor to ICSI, if he receives a formal details and a email from your side, and
Sure,
he further forwards to us, then we can take up at a respective place
sure.
with the government of India, with the echelons, wherever it is to be put across in a systematic way. Because
Absolutely, sir.
I personally presume that when you have been so kind to we appreciate your kind concern, your deep concern, your emotional concern, your professional concern, everything, we appreciate that.
Thank
But
you, sir.
the audience and the public at this point of time, uh,
This is
when
frightened. They're frightened.
yeah,
They're
yeah,
panicking. Yeah.
so thereby a proper PPT, proper picture, proper visual, proper documentation, and proper perspective. If a document is being put to the government, then
Yes.
I think we can achieve the purpose, because
Wonderful, Gulshan ji. I will work on it
yeah,
immediately. I
yeah,
promise. Yeah.
because
And
the audience, those are joining even on this program at such a short notice, they had been very kind to join us. It's going to be 10 p.m. night
thank
time
you.
in India. They all are
Yes, sir.
here. But
Yes, sir. Thank you.
I think being a medical emergency and medical concern, it would be most appropriate to take everything in a descriptive, elaborative, because like you put it across that even the paramedical people should not be
They
handling
should
it,
not do it.
they
No,
cannot
sir.
handle it.
Absolutely.
So
Yeah.
thereby I personally feel, as it's a highly professional way of handling it,
Yes.
keeping your concern, keeping your deep emotion, deep touch, and all the chords with India, we
Yes,
appreciate
sir.
and our deep gratitudes and thanks from the chamber for giving your most valuable time this evening. Thank
Absolutely.
you.
One more thing, sir, if I could
Yeah,
just add what the
please.
some people have means. The initial suggestions that I made are for everybody to follow. And then people who can have access to vitamins and supplements, they should take the following vitamins and supplements. Everybody should take vitamin D3, at least 5,000 units a day.
B
And
B3.
D3, D like dog,
Okay,
vitamin
D3.
D3,
Okay,
yes, sir, at least 5,000 international units a day.
okay,
And everybody should take vitamin C, at least 2 to 3 grams a day. chewable or swallowable, whatever is available. If zinc is available as an element, people should take. Here in this country, they were saying 200 milligrams a day for 3 days, but it can also be given as 50 milligrams. Even 50 is better than nothing. And then a multivitamin containing vitamin B12 and all vitamins has to be taken daily. So these are the basic things I would advise patients. Now, here in the United States, other doctors who are doing other things have also given a protocol for the treatment of COVID-19. And what they're saying is give a Medrol dose pack, give a Z pack, give ivermectin, 12 milligrams a day for 5 days, and give zinc. So these are the four things that doctors in the United States are treating um, patients with COVID, and this is also working. So this is more traditional medicine. Um, so ivermectin, 12 milligrams a day for 5 days. Zithromax Z-Pack, which is a 5-day thing or a 3-day thing, depending on which one is available. The Medrol dose pack is prednisone. It's a steroid, sir. And they are also recommending zinc. So this is this is the regimen they're following. And so I wanted to ask if anybody has any questions. I would love to help answer them. And please do not hesitate to call us. Um, there is some doctors, instead of the ivermectin, they're also using doxycycline, 100 milligrams twice a day for 14 days. And some other doctors are using hydroxychloroquine, 200 milligrams twice a day for 7 days. So these are the alternate regimens that are being used that are effective. And I can put this also in the handout that I'm sending to you. So either Zithromax and ivermectin, Zithromax and doxycycline, or Zithromax and hydroxychloroquine. This is a lot of people are using this, and this is what they're recommending. The hydroxychloroquine modifies the inflammatory pathways and prevents the body from attacking itself. And ivermectin and doxycycline are also working. Some doctors are recommending all Zithromax, ivermectin, hydroxychloroquine, and doxycycline. So I think the essential ones are the Zithromax, the hydroxychloroquine, and either the doxycycline or the ivermectin can be added. And then you have the zinc and you have the Medrol dose pack. So I will put all this in writing and send it to you. So where it is not possible to access medical oxygen, because now I'm sure it is in great demand in the hospitals, at least these alternate regimens can also be used. And everybody should take vitamin D3, vitamin C, if you have access to zinc, and definitely multivitamin. Everybody all over the country should take that. And we can also try and the problem is, for the last year in the US, it's been very difficult to bulk source these things, but manufacturing is coming back here. And I think we can also try to help. So another thing we have done last year itself is to Dr. Sonal Astana in Bangalore, who initiated the liver transplant program in Bangalore. We shipped 20 ventilators from here out of line, out of queue. We asked the Congress people to get them released from the manufacturer here. And they are the most basic ventilator that can be 3D printed. And Dr. Astana has had them for a year. I think they may be doing it. And we have offered to them to pay royalty to them so that they can manufacture as many as they want. I don't know where that stands, the progress on that, but that has also been done last year itself. So if anybody else wants to try to 3D print ventilators, he has 20 prototypes that were shipped last year, last April, I think, or May to India.
Thank you. Thank you, Dr. Priyaji.
Thank you so much,
Thanks
sir.
for your valuable
Appreciate it.
time and thanks for your valuable inputs and your concern.
Thank you,
And
sir. We
it
appreciate you
was at
deeply.
a very short notice that we organized this special emergency session. And
Thank
our
you for
thanks to
having me.
Dr. Vivek Shankar Natarajanji also. We will look forward to the document from your side.
Absolutely, sir.
Kindly send it across to us at the
I will,
earliest,
sir. Promise.
because being a medical concern, we got to go with the documents and we got to move formally. That's the
Absolutely.
way we can just take on. Thank you very much.
Absolutely.
And
Thank
we
you,
will,
sir. God bless you. And please take good
yeah,
care of yourself.
yeah,
You're very precious to all of
Dr.
us.
Dr. Sharma, this is
yes,
Vivek.
yeah. Please,
Thank
please.
you.
Just one message. Uh,
Yes, please.
you know, the Indian nation has seen many challenges, and again, we always bounce back. So I think
Yes.
it also be a blip, and with our immense, Rashtra Bhakti and Desh Bhakti that our people have, and we are the country where we are very innovative. There is frugal innovation, reverse innovation. That
Yes.
thing.
Yes.
I think we will innovate. We will find a solution. We just need to stay positive. Of
We will
course, it
save millions of
we
lives. Yes.
sitting away in a foreign land say that, but every moment we are crying not because we are not able to serve the motherland in a way that we could have been if we are on the road. So our thoughts, our prayers, and in fact I have made a hashtag NRIs for India. We are all with India, and wherever we can. And it's very incredible, even a lot of my colleagues from America, they've expressed solidarity. So the world's, I think,
Yes.
say that the world stands by India. I'm seeing even the CEOs of Indian origin, Sundar Pichai or Satya Nadella, they're talking about it. So this hopefully with that level of positive energy, I'm sure we will start to see a dip in the numbers. Our prayers,
Yes.
as they said, whatever we need to follow the medical protocol, we need to follow the law and order protocol. If it's manufacturing, we will get that. There is resilience, as they said, necessity is the mother of invention, and I'm sure the society will bounce back. Our
I think
prayer,
one. Mhm.
Anjali, to all the people who may have lost their lives, all those families. I know it's devastating, but I
And
think
our
this is mutations, and hopefully we all take more precautions. And
yes, and one more thing, Vivekji, just one more
uh,
thing. I didn't mean to interrupt. I think I want to add on to what you just said that even if people are vaccinated, or even if they've taken one or both doses, and even if it has been more than 2 weeks since the second dose, at which point they say you're immune, please note that India today has reported that there are more than 7,000 variants of this virus in India alone that they have looked at, that there are many more variants also that are happening. And so, what that means is, even if we are vaccinated, we may not be immune to all the variants. And even if we are vaccinated, we should continue to behave socially, publicly, privately, as if we are at risk for contracting a variant, maybe that is, they're calling them immune evading variants, Vivekji. And what immune evading variant means is that if somebody gets infected with it, they are not going to show a positive antibody on the test, which means people may not believe that they are sick until something bad really happens. The second thing that immune evading means is even if the vaccine makes them make antibodies, those antibodies will not attack that variant. So those are the two meanings of the word immune evading. So many of the some of the variants that they have isolated in India are immune evading. So taking the vaccine does not mean you will not get COVID. What it means is you will not get COVID from these dominant strains that have infected the Americas and Europe. And so I would very respectfully and humbly request everybody to continue to wear the mask and follow all those, even if you're vaccinated, so as to not get the other variant and also so as not to transmit the disease, which people can still do depending on which vaccine they get. They can still transmit the disease even if they don't get deathly ill from it. The one thing the vaccines have been shown to do is to reduce the risk of deathly illness from most variants of COVID. Hospitalizations of 100%. It protects from hospitalizations and from a very severe form of disease, the vaccination.
Thank you, ma'am. Thanks for your kind inputs. And thank you, Vivek Shankar Natarajanji.
thank you, sir. Thank you,
Thank you.
Gulshanji,
Thank
and please take care of
Thank
all of
you.
your health. Please stay. My prayers for the whole India ICISI team. I know we are doing great work. Please take care of your health. Please stay safe.